Well, two-thirds of adults in the U.S. are now fully vaccinated, and nearly 2.8 million people have already received a third booster shot.
The CDC today released guidelines for holiday travel, so there's lots to talk about with UW Health's Chief Quality Officer, Dr. Jeff Pothof.
Welcome back.
Hi, good to see you guys.
Hi, good to see you.
Same.
So, UW is pretty compliant. I mean, people had to be first vaccinated by October 1st, second by November 1st. What are the numbers there?
So we're looking pretty good. So of our 16,000 employees, 99.96% are compliant with that vaccine mandate, which is just a real testament to the commitment of our staff to not only take care of themselves, but to take care of their community.
Do you think those mandates are a big step toward addressing the vaccine gap?
You know, I think for two reasons. One, you know, it puts people in a position where they need to make a decision, but also it encourages those employers to then talk to those employees, understand what those gaps are, clear up that misinformation, and really get folks to understand why this is probably a good thing for them to do.
Let's talk about this antiviral therapy that's coming out, Merck and AstraZeneca. What's the science here?
Yeah, so it's really interesting science. So viruses, what they do is they use the machinery in our cells to replicate themselves. They give our machinery a secret code. What this medicine does is actually inserts additional letters into that code so it gets scrambled and the virus can't replicate. So it's kind of virus espionage in a way, which is kind of a cool way to think about it.
And when do you get that treatment? After you're diagnosed, or is it a preventative?
Right, so the study looked at folks who got it early on within their COVID infection who would likely have risk of getting severe disease. And when you give it to those folks, a small study, but a phase 3, about 750 people, it reduced hospitalization by about 50%.
Wow. But this is not in place of a vaccine.
No, so if we look at our vaccines, you don't have to get COVID in the first place, but vaccines, 90+% effective in preventing disease. This, 50-50, so impressive, but not as good as a vaccine.
What about the booster shots? A lot of people are getting them now. If you don't fall within the category that qualifies for one right now, if you're not immunocompromised, or I think it's 65 and older, are you still protected if you're fully vaccinated?
You are. So when we look at the data and we look at those folks who got, in this case, the Pfizer vaccine, that protection's still there. Now, what starts to wane is the likelihood of you getting a breakthrough infection. And that breakthrough infection is likely to be very mild, might not be much more than a cold. You may not even know that you had COVID. So there's that balance between going through the process of getting vaccinated when the benefit is only this small benefit for breakthrough infections versus older folks, immunocompromised folks, where when we see breakthrough infections that lead to severe disease, it's in that population. That's why the vaccine booster is recommended for them.
But it's only the Pfizer.
Right now, the only booster we have approved is the Pfizer. We have Moderna kind of waiting, now Johnson & Johnson in the wings.
That happened today.
But if you have Moderna, you can't get the Pfizer booster.
Right now, there isn't a recommendation to mix and match those. And with Moderna, the durability is a little bit better than the Pfizer vaccine. That immunity kind of holds on for a bit longer.
The CDC issued its holiday travel guidance today, and it said that it's probably the safest way to celebrate the holidays is to do it virtually. Now, what is that telling us?
Yeah, I think this is tricky because the CDC maybe has a crystal ball that I don't have, but it's hard to know what COVID's going to look like at the end of November and in December, if cases are going to be high, if that'll be universal, if there'll be areas of the country where cases are lower. So I think, although I think it's important to get guidance out there, it will be safest to say, hey, let's do that virtually, let's distance, let's keep those masks on. If Delta calms down, cases decrease, there may be parts of the country where it's not as high risk to those things. Kudos to the CDC for coming out with this. Things could change a little bit before we get to Christmas.
And some prominent doctors, national doctors, have disagreed with that. They say it's okay if you're vaccinated.
Yeah, I know. I think that's where it gets tricky because,
spot.
things are different in different parts of the country, and the CDC is speaking for the entire country.
Especially if you have kids that can't be vaccinated.
Yeah.
That's where the problem's coming in.
How important do you think it is to get a flu shot this year?
I think it's real important. I think we're going to see more flu cases this year than we saw last year. We have a lot of COVID cases right now. The last thing we want is flu patients competing for COVID patients, competing with the rest of the folks that need hospital beds for our hospital beds this fall. So the good news is that you can get that flu shot and that COVID booster at the same time. So maybe one appointment, get both shots, 2 birds, 1 stone. That'd be the way to do it.
Do you think everybody will get boosters? or just select groups?
I think, at some point we'll see where everyone gets a booster. I think the big difference will be timing. When is the right time? When do we see immunity waning enough for those folks that are healthy, that have a good immune system, where they need a booster? And I think we'll probably see COVID vaccination boosters on a similar timeline as flu. Maybe it's once a year, maybe it's a little more duration than that, every 2 years. But I think we're going to see boosters for COVID-19 sticking around.
Every week we have so much to talk about.
We do. We need more time.
Doctor, thanks for being with us again.
We appreciate your
See you
time.
next week.
Yeah, good to see you.
Same.
We'll have a final check of your forecast coming up.